And thank you so much for joining us for today's Florida Hospital Healthy 100 web chat. I'm Jennifer Roberts. Today we are taking on a topic that is impacting lots of people across Central Florida. That's the flu. Lots of people don't want it, and a lot of people end up getting it. We brought in a physician who's literally on the front lines of the flu fight this year and every year, Dr. Timothy Hendrix. He's the medical director at Florida Hospital Centra. Dr. Hendrix is going to be here to take your questions about the flu and work through some of those myths that we all hear circulating around when the flu season gets especially bad during the winter time. So we'd love for you to type in your questions. We'd love for you to send us an email. We'll give you that address at the bottom of your screen here in a little bit. We're going to try to get to some of those questions over the next 20 minutes here. So the doctor is in. Let's not delay and get things started. Dr. Hendrix, thank you so much for joining us today. So to start things off, let's talk a little bit about what the flu season has been like to date here in Central Florida, because we've seen lots of reports about what's going around the country and how crazy things have gotten in some parts.
Well, especially in the South, but here in Florida and Central Florida, we've experienced the worst year we've seen in several years. We've been keeping numbers at Centra in terms of volumes of patients coming in since 2007, and we haven't seen these types of numbers since that period of time. And even looking back several years before that, I don't think we've seen this kind of volume of traffic coming into Centra with influenza.
So it's obviously been a very busy year. Is there any attributing that to any reason why that is? Some years are busier than others.
You know, the flu is a real mysterious virus. Nobody can really predict what it's going to do. All we can do is predict that the flu will happen in the wintertime. That's about as good as it gets. We can try to predict, or the CDC and the World Health Organization tries to anticipate what virus will be circulating, so we know what virus to put in the vaccine to vaccinate people against. But other than that, whether it's going to be a severe season, whether the virus is going to mutate and change throughout the season and make it last longer, you just don't know. But what we do know is when we get to peak volumes like this, when we see the most number of people, the CDC will tell us that it's at least 10 to 12 weeks before we get back down to baseline levels. So we've got at least a couple more months of flu out there.
Well, I heard that we already have a couple of questions here, so I want to try and get to those here quickly. Of course, my didn't refresh quite here. So let's talk a little bit about, before we get to that, let's talk a little bit about flu prevention. Some of the things that you can do if, knock on wood, you do not have the flu and don't have it yet. How can you prevent from getting it?
First and foremost, get your flu shot. It's a very effective way of reducing your chances of getting influenza. Secondly, and I get this question a lot, if I wash my hands frequently, if I use those hand sanitizers, other things like that, wiping down surfaces with Lysol around the house, all those things are secondary measures. The primary thing should always be that flu vaccine. And who should get the flu vaccine? Anybody over the age of 6 months old. So infants down to the age of 6 months, up to any age beyond that, basically, should get their flu shot. Now, there are high-risk groups that every year we try to concentrate on and making sure that those high-risk groups are immunized. So anybody over the age of 50, 55, young children under the age of 2, pregnant women, anybody with a chronic disease like asthma, diabetes, heart disease, all those things put them at risk of severe complications from influenza. Because influenza, even though it sounds like everybody's just sick, people die from the flu. And we've had, annually we get about 40,000 deaths a year from the flu nationwide. This year we've already had 20 pediatric deaths that the CDC follows very closely. So I'm not saying that this is a that pandemic type of situation where we're seeing a lot of, this is your typical routine bad season that we're unfamiliar with because we've forgotten. It's been a couple of years.
Yeah, it has been a couple of years since we've really seen a bad one. Let's talk about the flu shot a little bit. Tell me, you know, there are all kinds of myths and things out there about the flu shot. Whether or not the flu shot can give you the flu. And I know you hear so many more than I would even hear, but tell me a little bit about what are some of the myths you hear, and let's debunk those.
Well, first of all, that I will get sick if I get the flu shot, and that doesn't happen. There's been multiple studies over the years to disprove that. And the main reason people think that is because when do we give the flu shot? In the fall. When does cold and flu season start? In the fall. So the chances that people are becoming ill with any other number of virus that's out there, getting a cold virus that's being passed around. So that coincidence with them getting the flu shot has created some of that myth that I'll get sick. The flu shot contains a killed virus, a killed version of the virus, so it's impossible for you to get a flu infection from the injection. Other things about the flu shot that I hear is that I'm allergic to eggs. Now that is a serious contraindication to getting the flu shot, but has to be a serious allergy to eggs. It's not just indigestion or you can't tolerate eggs in your stomach, but more an allergic reaction. And the CDC tells us that if you can eat lightly scrambled eggs, if you can tolerate those lightly scrambled eggs, you can get your flu shot. So those are the two big ones that I hear.
Okay. Talk a little bit about, you mentioned washing your hands, just so key in this. One of the questions that we have, what's better to use, soap and water or hand sanitizer? We go about this debate all the time. Don't you hear this one all the time?
Well, and I also hear concern that, can you wash your hands too much? Are you removing the beneficial bacteria off your skin?
Using the antibacterial. Some people worry about that.
That's wrong. That's wrong. Now, just think about it this way. You have a lot of skin surface. You're only washing 2% of your body area when you wash your hands. So you've got plenty of bacteria on your skin. Don't worry about that, number one. Number two is whatever's available. If we prefer that you wash your hands with soap and water frequently throughout the day. Anytime you touch your mouth or face, you should wash your hands with soap and water or touch other individuals. But also the hand sanitizers are very effective. So I'd say whatever you can lay your hands on at the time, as often as you can during year round, not just during flu season, just make it a habit.
So one of those things, whatever you can get is always better than nothing.
Exactly.
Yeah. Okay, good. Let's go, we got some more questions here, and I'm able to see some of these. Some people have complained about a stomach flu, but is that really the same thing as the influenza flu that we talk about?
No. There are 3 different types of flu that people quote, okay, but it's influenza is very characteristic, and when we see influenza, it's high fever, body aches, extreme fatigue and malaise. You just want to crawl into bed and not come out for a week, and literally it'll knock you down for a week of fever and then another week of fatigue. The people I've been talking to that I've been seeing in the clinic, they've been out for a week or two just with trying to recover from the illness. This is a serious infection. Upper respiratory viruses, coughs and colds, runny nose, low-grade fever lasts for a week and it's gone. That's not the flu, that's a cold, common cold. And then your intestinal flu, your GI bugs, that's completely different. Those 24-hour intestinal viruses, vomiting and diarrhea, are a completely different ball of wax. Sometimes with influenza, you'll get some stomach upset from the fever, maybe a little loose stools, maybe some vomiting, but generally that's a very small feature. The big part of this is just the fever and body aches. If you're throwing up, if you've got diarrhea, you've probably got a different infection, and that usually recovers the GI bug in about 24 to 48 hours.
Yeah. When you talk about the difference between cold and flu, I would imagine during this flu season, you see a lot of people coming in with something, but it's not always the flu. Talk about that. I know people sometimes expect to get certain diagnostic medication after that.
Well, when I see people, and I saw a lot of people on Monday at Centra Care, I probably diagnosed 6 or 7 people with influenza. They had very characteristic symptoms. I saw some people with pneumonia as a complication of influenza, or it just came up out of nowhere. They had lung infections. But we're also seeing probably 2 or 3 times that number in upper respiratory infections, coughs and colds and runny noses. So people are coming to us and we're helping them sort out, okay, you've got a cold, there's really nothing you can do. This is a virus. There are 200 different respiratory viruses that are out in our community around the United States that can cause a cough or cold. And those generally last about 7 days. An antibiotic is not indicated. There's nothing you can do for that cold. The flu is also a virus. Antibiotics don't work against viruses for influenza, so don't expect your doctor to prescribe an antibiotic if you have influenza, but there are antiviral prescription medicines. Tamiflu and the Influenza are the 2 medicines that are available, and that's what we can do to help shorten the course of influenza. I like to tell people before I prescribe Tamiflu to remember that the medicine only will shorten the course by a day or 2. You're still got a few rough days ahead of you.
Yeah, makes sense. Totally makes sense. I know we were kind of bouncing around a little bit. I wanted to make sure we could get to some of the questions here too. Got another one. My daughter turns 6 months tomorrow. Should she get the flu vaccine? I know you said everybody over 6 months initially, but that's pretty close, right?
Right, right. I mean, that 6 months, that when they turn 6 months, that's fine. Go ahead and get their flu shot. Is it safe below that number? We're not going to say that. The CDC basically has that cutoff. What would happen if you gave it too early? We don't know, but we're not going to try on the little ones.
Yeah.
And that leads to a very good question I've gotten a lot from people is, what about my child that is 5 months, 3 months, 2 months old?
Right.
These very young are very susceptible for influenza. So how do you protect them?
Yeah.
Have the family get their vaccine. Right. Surround that child with vaccinated people that aren't going to bring the flu home to them. So the main goal is to make sure the family's vaccinated.
So great response for this mom too. Not only does her 6-month-old needs to get it, if she doesn't have it already, she should too. Good point. And talk about, there's a lot of people that have strong opinions about the flu shot. I mean, there's a lot of things that circulate on the internet about whether or not there are harmful things in the flu shot that you shouldn't get. You know, a lot of myths and things out there.
Right, and I think that as we get into a serious season like we've got right now, we've got a lot of sick people. I bet there's a lot of people re-looking at their beliefs on if this is bad or not, because once you get influenza, everybody I've talked to that I've diagnosed with influenza, the question I ask on the way out the door, are you going to get your flu shot next year? They said, no doubt. They do not want to go through this again. So there are a lot of misinformation out there. And thanks to our internet, which is a great source of medical information from reliable sources, there's a lot of unreliable data out there. And I'd say stick with the CDC, Florida hospitals information that we've got out there is going to be your safest, most reliable.
Absolutely. And we thank you for helping us get reliable information out there. One other question too, talking about shortage of Tamiflu. We're talking about some of those preventative, or not preventative, but treatment after you get the flu. Is there a shortage of Tamiflu here in Central Florida? One of the questions coming in says they've heard shortages in other parts of the country. What are we seeing here?
I have not heard, I've not gotten any calls to my clinic regarding inability to get Tamiflu. I was at a pharmacy yesterday and talked to the pharmacist. They say they've got plenty of Tamiflu. Where they are having trouble with Tamiflu is the pediatric dose.
Okay.
So the pharmacist, I got a call today, is it okay to compound? So they're compounding, they're taking the adult Tamiflu and make it into a liquid for the kids at the same dosage. So no, there isn't a shortage, but we are seeing some spottiness, especially around particular types like the pediatric liquid Tamiflu.
Right, okay, understandable. And the flu shot, while we're talking about supply out there, is there plenty of flu shot out there for people in our community?
Yes, there's. We have all of our centers at Centra have been restocked with flu vaccine this week. There may be time in lag when different stores or doctors' offices try to order the vaccine from the company. There may be a day or two where we're seeing gaps. The government is telling us that there's plenty of vaccine for those people that want it. So there's still a lot in reserve, so to speak, but it's getting it out there to the public. The problem is a lot of doctors, a lot of practices, they order a set amount for a year, they give out all those shots, and there's not a restocking. So when we get into this critical time of year when a lot of people realize, I want the flu now, or flu shot now, not the flu.
Not the flu.
But I want the flu shot now in the middle of peak season. It's kind of late, but we really need to take that opportunity to get them vaccinated. But the doctor's offices now have to go back and order that.
Yeah, and we're in January now. Should people still consider, there's lots of supply, should people still consider it? It's not too late.
Definitely, because we are still very early. Our peak season annually is always in February and March. So we're about a month early. Does that mean we're going to end early? Probably not.
Yeah.
That means this is probably going to drag throughout the winter because the conditions are ripe for a very long season, meaning cold weather, dry weather. It's an early start to the season. The virus likes to propagate in those cold, dry conditions. People are coming together in the wintertime, so it's going to drag out for a while.
Yeah, yeah. Another question we have, will the flu shot keep one from getting the flu? I know there's a lot of talk about how effective the flu shot is.
Well,
so talk about that.
All right. Now, my official line is yes, it works great.
Yeah.
All right. But we know that the vaccine is not perfect. No vaccine is perfect. And the CDC on the 11th this month published in their Morbidity Mortality Weekly Report their review of how effective it is. And the current shot is about 62% effective at preventing the flu. Now, you look at that and you're like, well, those aren't really great odds, but they are, because you've got to have yourself vaccinated, and the more people you have vaccinated around there in the community means that there's less transmission of the virus through the community. So it's not just you getting your flu shot, it's everybody else around you getting that flu shot. And also, if you don't get your flu shot, what are your chances of getting the flu? It's 100%.
Yeah.
You know, so 60% is still very good, but that is not unusual. Yearly, we know that the vaccine protects about 70% of the time. So we're right around what we usually expect for effectiveness. Now, another topic is flu match, meaning the virus that's circulating in the community versus what is in the shot is a good match this year. Exactly what's in the community is what we've got vaccinating people this year.
Oh, fantastic. That's good to know. The other point about the flu shot, you know, even if you did get the flu, does it mean that if you got the flu shot, you might not get it as bad, or it might be a little bit weaker?
Yeah. Thank you for pointing that out, because you have antibodies against the influenza. After the flu shot, you mount those protective defenses. Those antibodies are built up. So when you get an infection with influenza, it's not going to be as bad when you've had your flu shot. So you may not have as severe of an infection.
Let's talk about where you should go get a flu shot, because I know there's a lot of places in Central Florida that have supply, but I know here at the hospital, our emergency rooms have been busy with treating people from the flu.
Right.
What are your recommendations about where to get the flu shot and where to get treatment for the flu if you have it, or you think you have it?
Well, number one, if you have influenza and you have a very serious complication, you're having difficulty breathing, severe headache, vomiting, lethargy, something like that, you need to go to the emergency room. Okay, if you're depending on the seriousness of your infection. If you're suffering from just high fever, body aches, and misery, go to Centra, go to your doctor's office. We want to keep as much flu away from the hospital as possible, because we've got a hospital full of very fragile patients that we don't want them that virus spread. We want to reduce it as best we can. So the best place to go for influenza is an urgent care like Centra or any other doctor's office outpatient setting. For the shot, like I said, all Centra Cares have influenza vaccines, so the vaccine's out there and available. You can also check with your health department or your primary care doctor. Of course, the emergency room won't be vaccinating. They don't typically vaccinate people, so don't go to the hospital looking for your vaccine.
Right, and you know, good point to try and get that done. Other places too, you can save a little money if you don't go to the emergency room for your treatment of the flu.
Another very good point. Yes.
Yeah, so it's definitely best to keep that with your primary care doctor or urgent care.
Yeah, and urgent care. I mean, it's minor emergencies. Those upper respiratory infections, coughs. I've treated pneumonia twice on Monday. Sent them home with antibiotics. We're going to keep a close eye on them. They didn't need admission into the hospital. And that can be a hard call sometimes. But if there's any question, go to Centra, doctor evaluate, and if we need to, then we'll ship you over to the hospital.
Right. Wanted to give people some options in the chat too. Florida Hospitals just launched an emergency room app that we wanted to make sure and share. What you can get on that app is locations to Florida Hospital Centra, as well as Florida Hospital emergency rooms, and wait times for all of those locations. And one of the things that you were talking about so importantly, there's some signs and symptom checkers on the app as well. That if you have these symptoms, you might want to go to the urgent care. If you have these more severe symptoms, maybe it's an emergency room visit. How helpful do you think that would be for people?
Well, very, very helpful, because sometimes it's hard to tell is your symptom. And honestly, when you have the flu, if you've ever had influenza, you know, trust me, I've seen enough of them. It looks pretty severe.
Yeah.
They feel like they're dying, but that's not needed in the emergency room. We can take care of it at Centra. So sorting through some of those symptoms in an app like that is very useful to kind of direct you on what resources are available. A lot of people don't know what urgent care is. It's, you know, we've been around for over 25 years, but people are starting to learn that these walk-in clinics have that capability to handle this set of problems, but to help them understand that, okay, primary care, urgent care, ER, those apps are very good.
Yeah, and not to mention free. So that's always good to get to get wait times at your fingertips for free. That's always a good thing. And so, you know, you guys are seeing quite a few people. Talk about some of the volume that you guys are seeing at Centra with this flu shot. I mean, excuse me, with the treating the influenza.
We're seeing a lot of people.
Yeah.
All right, number wise. our peak during the holiday week after Christmas, we saw 637 people. And that's the most we've ever seen at CentraCare for influenza in 1 week. And since then, it's stabilized right around 600, just under 600. A lot of that volume coming, of course, from our visitors to the area. We've got a high influx of not only tourists to the attractions area where we have urgent cares, but also people visiting family. I work at the Sanford CentraCare, way away from the attractions, but I still saw a lot of visitors in town. So those types of people that come in to visit family, those numbers, those people have left. They brought all the virus with them. They left it here. So now we're still dealing with the virus. I'm not blaming our visitors, honestly.
Yeah. It's not all their fault, even though it all seems to be happening in other places and bringing it here, right?
And that's the question is, well, if flu season happens in the wintertime when it's cold and dry, Florida isn't cold and dry. It's cool and dry-ish, you know. But again, we've got, once the virus starts going through our community, it spreads, and it doesn't need just a winter environment. It just needs sick people to spread.
Yeah. We did get another question. I know we've kind of covered this, but just to make sure if this person missed it, the recommended age for children to get the flu shot, and you were saying very early on.
Over age of 6 months.
Yeah.
Yeah,
Are
as
there
long as you're
different,
6 months old.
Are there different vaccinations for kids? What are the various vaccinations that are out there? Because I know some people were looking for certain vaccinations and having a little bit of a hard time with that.
There are thimerosal free, completely free of thimerosal vaccine available. And a lot of parents want to make sure that they have that pediatric dose that doesn't have thimerosal. Thimerosal is a preservative. It contains a little bit of mercury, very tiny, tiny amount. You eat more mercury in a can of tuna than you can from an immunization. Okay, but with those concerns, they have vaccine that's absolutely thimerosal free. We have vaccine that has tiny, tiny amounts that occurs early in the process of making the vaccine. So there are pediatric doses that can't be called thimerosal free because it's used early on in the process of manufacturing. Also, there's a nasal spray. So I'm not as familiar with that one because not a lot of people like the nasal spray. It causes a little bit of runny nose, and part of the process of developing that immunity is to inflame the nerves, so you get a little bit of runny nose and sneezing for a day or two afterwards. So that's an alternative to the shot, and that nasal spray is available. We don't have it at CentraCare. Like I said, it just never really took hold with people. Would rather just get the shot and get it over with.
Yeah, get the shot and be done with it.
Yeah, and that has a limited range, and I think the age is like from 2 to 60 or 55. There's a fairly narrow range, but don't quote me on that one.
Yeah, I hear you. And I know you don't have a crystal ball with this one, but where are we in the flu season? I mean, traditionally, do you think, based on what you've seen so far this year, we've hit a peak and are maybe moving downwards? I know we're all hoping for that, but is it more just wishful thinking?
Wishful thinking.
Yeah.
I think, seriously, we have not seen things let up. Our volumes are down a little bit in terms of flu, but like I said, I think that's a lot of our population has shifted back home, so to speak, out of Central Florida. So the people that are still here, we're still seeing a lot of flu out there, so we've got several weeks.
Fantastic. Well, I hope that's not the case, but and we can vaccinate a bunch of people in that time to not get
Now's
the
the
flu.
time. If you get your vaccine, you have to worry about it. I'm not concerned about it. I've got my vaccine. I've never gotten the flu. Thank you. And I vaccinate my family, and they complain bitterly every year. When my kids, when I bring home the flu shots, and I say, guess what? Line up because we're getting your flu shots. Because if I can prevent that, like I said, my secondary line of defense, and have those people vaccinated that I live with, I'm going to reduce my chances even further of getting influenza.
Well, that's saying something. For as many people as you treat for the flu not to have gotten it, that says something for the flu shot in my book. One last question before we wrap things up today. Folks are asking here, a pediatrician doesn't have the infant flu vaccine available right now. Is that something that you all have at CentraCare?
You'd have to call our centers and find out.
Okay.
There are 3 or 4 different manufacturers, and some are approved down to age 2, some are approved down to age 3, some of them are approved down to age 6 months. And I'm not sure which one we have at CentraCare.
Okay, so
you can just
call and find out and make sure that even location has the one that you're looking for.
Yes.
Yeah, fantastic. Okay, that's all the time we have for today's Healthy 100 chat on fighting the flu. I want to thank Dr. Hendrix for all of his flu expertise and great advice. Thanks so much for joining us. And if you'd like more information on where to get a flu shot, or if you think you might have the flu, you can visit Florida Hospital Centra Care's website at centracare.org. That's a great place to go for information. If you have any questions, or if you want to call a Central Care location again, find out what the status is. You can also check out that new emergency room app that we talked about. Just search Florida Hospital ER Wait, and that's for iPhone, Android, BlackBerry, so it gets a lot of different devices. So certainly something to check out if you want to look at those wait times and also those signs and symptoms of where to go, urgent care or the emergency room. So thank you so much for watching and participating in our chat today. We hope you'll join us again, and we'll leave you with a fun video to remind you of a great way to prevent the flu. Just wash your hands.
Wash your hands!
What? You didn't wash your hands?
What's up with it? Wash your hands.
At Florida Hospital, there's a protocol.
Wash your hands.
In and out of a patient's room, you should always
Wash your hands.
It's all about infection control. That's why we wash our hands with some disinfectant soap or foam. Wash your hands.
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 You never know what bacteria you might have on your hands. As a standard precaution, you should always
Wash your hands.
We live healthy 100 here, that's why we wash our hands with some disinfectant soap or foam. Now rub it in and kill those germs, and that's how you can wash your hands.
Wash your hands.
Wash your hands.
Wash your hands.
You can wash your hands.
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 Infection control is protocol. It's what we aim to do. Best practices are how we live. It starts with me and you. Infection control is protocol. It's what we aim to do. Best practices are how we live. It starts with me and you. Wash your hands. You can wash your hands.
Wash your hands.
Wash your hands.
Wash your hands. Wash your hands.
Just wash your hands.
We have washed our hands.
Wash your hands.
Wash your hands.
Wash your hands. Wash your hands.
Wash your hands.